And we move forward to our next guest. We have Sharif. Hello, Sharif. How are you doing? Welcome
Hi,
to
how
the
are you?
telethon. I'm doing well, sir. Um, I'd love to start with kind of having you introduce yourself and let us know um, why are you spending some time with us here on Giving Tuesday. I'm glad you're here.
Of course. No, it's a pleasure. My name is Sharif Tabebordbar. I'm a scientist. I have trainings in muscle biology and gene therapy, and I also have family members affected with FSHD. So that's why I'm interested in contributing to this cause and being part of the great event that you're putting together.
Yeah, I read that you have family that have FSHD. Is that kind of the catalyst, the driving force that got you into this work?
Exactly. So I grew up watching my father specifically struggle with FSHD since I was a teenager, and I could see different phases of his disease. And that was basically when I decided that I want to devote my career in basically making an impact in the quality of life of patients affected by genetic muscle disease. I started studying biology, and I decided to go into research, applied to schools that had programs on muscle biology and developing therapeutics for muscle diseases. I did my PhD in the same area. I studied at Harvard, and then after that, I joined the Broad Institute in MIT and was able to develop a technology that can actually have a big impact in the efficiency of gene therapies for different forms of genetic muscle diseases. And currently I'm working in an industry setting. I started a company named K Therapeutics that's focused on using this technology for developing more effective therapies for genetic muscle disease.
Wow, man, you are a superhero in my mind right here. You're rattling off schooling with Harvard, MIT. Then, of course, you're the driving force of your father has this disease. Man, FSHD messed with the wrong guy. That's what I think. And you're kind of, yeah, this is awesome. There is something that I was given a little bit, of some of the work that you were working on or that you are working on. And I don't want to butcher the heck out of this because I'm not a scientist. Big surprise to most. It is a development use called direct evolution. Is that right?
Directed evolution.
Yeah. Yes. Can you explain a little bit about that for layman people like myself and
of course
look like, and how does that help us with this FSHD?
Yeah. So basically, for any form of for treating any form of genetic disease, one way is to deliver, a healthy copy of the gene, or some sort of therapeutic that can get into the tissue of interest. For genetic myopathies, obviously, you need to deliver the therapies to the muscle. And the most common way for delivering therapies for genetic diseases is by using these non-pathogenic viruses that are called adeno-associated viruses, or AAVs. So these are viruses that are present in nature. Individuals are actually get infected with AAVs all the time, but they don't know it because it doesn't cause any disease. One of the major problems with these AAVs that are currently in human clinical trials is that most of it gets into the liver after it's injected to the bloodstream. So majority of these viruses get sequestered to the liver, and only a small percentage get to other tissues. One way to tackle this problem is to engineer these viruses, to change their surface, and to evolve them in a way that instead of them going to the liver, they go to the target tissue that you're interested in. For genetic muscle diseases, you obviously want these viruses to deliver your therapeutic into the muscle. And the technology that we use is called directed evolution. It's actually a technology that won a Nobel Prize a few years ago, which it's a forced way to evolve something, to push something, specifically specific proteins on the surface of this virus to have your desired characteristics. The desired characteristic in our case is for these viruses, after you inject them into the blood, to go to the muscle tissue. And that's basically what we did. We evolved them. We changed their surface and we engineered these viruses so that instead of mainly going to the liver, they're very effectively going to the muscle tissue, delivering your therapeutics to the muscle, so that you can use much lower doses of virus. That's the major problem that a lot of the current ongoing human clinical trials have. They need to inject enormous doses of virus to patients, and that has resulted in toxicity issues in the liver. It also limits the population of patients that can get treated with gene therapies because the amount of virus that you inject is dependent on the weight of the patient. So adult patients are mainly excluded from these gene therapy clinical trials because they're heavier, and production of that much virus is problematic. Also, it comes with potential toxicity issues in the liver.
So it's basically a better, more efficient delivery method for treatments to get right to the muscle. Am I kind of understanding that?
Exactly. My answer was very long. I'm sorry.
No. It was totally perfect. Because I never realized that that's how treatments in general, get delivered to people, was through a virus. And it wasn't until doing these shows and episodes with scientists and understanding that a little bit of the science behind treatments for people. And I was like, wow, they use virus. Okay, that makes sense. Something that your body can accept, almost like you're sneaking something in, like a Trojan horse, so to speak. And then the delivery method.
I wouldn't call that a Trojan horse specifically, because Trojan horse delivers the enemy. But this is
right. All right, Sharif, you got me on that one.
Sorry.
No, you have to correct me. Are you kidding me right now? I did not go to Harvard. I mean, come on. This has to be this way. No. I love the fact, though, that there are some key words in there, and one was, and I try to listen to this from the aspect of all our other listeners, and like, what would they ask Sharif? What would they ask the scientists if they had the opportunity? And obviously, Facebook is a way, because we're streaming, and if they want to ask something, they more than welcome to, and I will pass it on. But the one thing that you kind of said something about, genetically changing or modifying, this virus. Do you think that scares people a little bit if they hear that? Do they get too science fiction on you when you try to describe
that's a very good question. I think it's very important. I mean, with pandemic, everybody is scared of virus.
Right.
So what's really important to know here is we are not actually using a live virus here. We are just using the protein shell on the surface of this virus. Okay. And what's within the virus is the therapeutic that we want to deliver. So it's either a healthy copy of the gene or the components of the gene editing machinery. So whatever you want to deliver. But we're basically using the protein on the surface of this virus as a FedEx truck, right? Like we need to give it the direction to go to where we want it to go. And by directed evolution, we're actually providing that direction and giving that direction to that FedEx truck, which is the protein shell of the virus, that, okay, go to the muscle, don't go to the liver, don't go to the lung, don't go to the kidney. That's the analogy I think that I can use to most effectively communicate that. It's certainly not a live virus. It's not something that's able to propagate. It's called a recombinant virus, which means that it's only the surface part of the virus that allows the therapeutic to get to the desired tissue that we want it to.
Perfect. Okay. Because I'm not worried, but there might be others, right?
Of course.
Like you said, pandemic. He said the word virus, and then this will be good, people. It's okay. Sharif's on it. We're
and these viruses are now in clinical. There are 2 FDA-approved drugs that use AAVs. There are more than 200 clinical trials that are using AAVs. So it's like it has been proven over 20 years that it could be safe if you use it at lower doses.
Got it. So how important then is a day like today to your work, a Giving Tuesday, funding, where we have a match of, $200,000 out there right now. We're trying to, hit that mark. For your work, from your perspective, what does a day like today mean?
It means a lot, actually. Supporting research is the key. For FSHD specifically, there are still a lot of unknowns about the biology of the disease, about how the mechanism works, and then what are the potential therapeutic strategies that could be pursued. There are many different groups who are dedicated and working on this, and days like today can actually provide the resources for scientists to be able to move forward and push making new discoveries, come up with new treatment strategies. The technology is getting there slowly to be able to basically at least see the light at the end of the tunnel, but there is still a lot of work to do. And days like today can provide the resources for scientists to keep going.
Yeah, it's well put. Yes. And I know you're motivated to help us as a community, but also help your family that's been directly affected by this. And that's huge, of course, for all of us. And to have you vested to that degree is just an added push. I can only imagine the feelings you have when you're, in this work, pushing hard. It's now something that's personal for you. As you go now into 2022, what are your hopes for the upcoming year?
What are my hopes? My hope is, to have an even more productive year and to keep pushing forward as fast as possible to, try to develop new technologies, try to use the technologies that we've developed for developing therapeutics for genetic muscle disease. Basically, keep going at the same pace and cranking away, trying to find a path forward for making a difference in people's lives. That's what I hope for.
I like that. Finding a path forward. Well, we're right behind you, Sharif. We're going to do everything we can to help you and make sure that FSHD Society's got your back. And I really appreciate the work you're doing. I admire it. I don't completely understand it, but I don't have to because I trust you, Sharif. And you explained it so well, and I appreciate your time today on Giving Tuesday, doing that for us and letting you know how important it is for this day and how it helps your research and what you're doing for us and your family.
Thank you. It was a pleasure.
So
thanks for having me.
Absolutely. We're gonna have you on again. This was too much fun and it was too short. So it was too much fun. All right, thanks, Sharif. Take care. Enjoy your day. That is Sharif is a scientist. Man, when he said Harvard and MIT, folks, I mean, are you out of your mind right now? I mean, that's insane. It's a 1-2 punch. And when I always tell people, I get a little intimidated when June or Lee suggests, hey, let's have a scientist on. I'm like, okay, I have to wrap my head around the science of this. And I understand the basicness of it, but to ask a scientist a question so that we can, pull some information out, understand what's going on, is always a challenge, a fun challenge, but always a challenge. So I really appreciate Sharif coming on and talking more about his work